at Hope Grows for Autism. My name is Jennifer. I'm from Autism Connection of PA. We're a nonprofit based in Pittsburgh. The outline for today is basically about an hour or so of Richard and Erica presenting, and then the last half hour will be for a Q&A. So we ask that you please stay muted until the Q&A portion. And so with that, I will have Richard take over.
Awesome. Thank you so much, Jennifer. I'm just going to go ahead and pull my screen up here to get started. First, let me say, definitely thank you everyone for joining us today. Honestly, very honored to be here. Very honored to kind of share some of the perspective on cannabis in Pennsylvania. Hopefully give you some insight as to treatment options and or hopefully relief that we can provide through medical marijuana in the state of Pennsylvania and actually beyond. And honestly, just kind of hoping, this is a very fruitful dialogue. That's more than anything, that's what it is. We want to share some perspectives, but also understand, especially from a dispensary standpoint, we are partners in this. No one's journey is, not everyone's journey is the same. We see a lot of, unique characteristics, different symptomology, all kinds of different things that we do try to take into account with cannabis therapy. And again, hopefully we can just provide some nice perspective on that. But again, thank you for not only having us, but also for joining us today. Let me see. Okay, just some very quick objectives. I'm going to go through some still quickly, but a little bit more formal introductions of myself, of Solevo, the company I represent, and then get into an introduction of our very esteemed speaker, Erica Daniels, who is founder and president of Hope Grows for Autism. And then hopefully share some perspectives, not only personal, but also professional from inside the cannabis industry. And then ultimately, I would like to end just with some advice and some easy resources, very efficient ways to kind of pursue cannabis therapy for anyone with autism, whether it be a patient or caregiver registration process, but ultimately simplify that process for everyone. So it's very efficient and seamless there. Very quick introduction of myself. I am a licensed pharmacist. I went to Duquesne University for pharmacy school quite some time ago, it feels like. I did ultimately go through the curriculum, graduate, pass my boards, and ultimately was issued a license through the state of Pennsylvania, actually through the Department of State, through Harrisburg. A little bit of a distinction, I am considered a medical marijuana practitioner by the state of Pennsylvania because I did the extra requirements for that in particular. But through that process, I'm actually registered with the Department of Health as a medical marijuana practitioner, so a slight distinction there. One thing I do have to say, this is one of the requirements of the fine print I need to mention. Medical marijuana is not FDA approved and is under investigational use only. I do not like that term, investigational use, and hopefully after today, a lot of you will see there is science, there is a lot of efficacy. There is a lot behind this that goes into assessing a patient and ultimately getting them relief. It's one of the things the FDA makes me say. Again, I don't like the word investigational, but there it is on the screen. Real quick about Solevo. So Solevo Wellness, we are a medical marijuana dispensary based in Pittsburgh, Pennsylvania, dedicated to providing medical marijuana relief solutions for Pennsylvanians certified with serious medical conditions, of which there are 23 qualifying conditions, but today we are here to talk about autism. Autism is definitely one of the primary conditions we see at Solevo Wellness, especially amongst our pediatric patients. Solevo was originally founded by leading physicians, pharmacists, as well as medical professionals, and we do our best to offer personal, professional care and offer the best quality medicines we can that are produced and tested here in Pennsylvania. I always say fundamentally we are a dispensary. We are licensed through the state of Pennsylvania to legally dispense medical marijuana to patients. But with that being said, we also offer as many educational resources as we can, such as today's presentation. And we do offer assistance with the process of becoming a patient and caregiver. We really want to offer a concierge service, honestly, holding people through the entire medical marijuana journey, dealing with the Department of Health, getting a card in your hand, ultimately coming to see us for a consultation and being dispensed medical marijuana for some benefit. We're open 6 days a week. The only day of the week we are closed is Sunday. Monday through Friday, we're open 10 a.m. to 7 p.m. Saturday, 10 a.m. to 4 p.m. And we are closed Sunday, as I said. I'll get a little bit more into contact information at the end of the presentation. But without further ado, I do want to go ahead and introduce Erica Daniels, as well as her company, Hope Grows for Autism. Erica is the mother of a child with severe autism who is determined to give her son and family the highest quality of life possible. Her life changed and gained new purpose when her son was diagnosed with autism in 2007. After years of traveling the country, seeing specialists, attending and attempting dozens of treatments for years with little or no success, Erica eventually discovered that natural treatments such as diet and medical cannabis dramatically improved the quality of life for her son and for her entire family. Erica, she is an internationally recognized medical cannabis activist, autism advocate, author, public speaker, and a devoted mother. She is compelled to help as many families as she can and continues to make waves in the autism community. With that being said, I'm actually going to turn this over to Erica because I'm sure she can give you more insight on her as well as her organization. One thing I will say, I 100% vouch for Erica Daniels. I always give the story when I was going through my training. She actually gave me some of the most impactful information and training that I received just from her perspective as a mother with a child that has autism. I've read the textbooks, I've attended plenty of lectures. I've definitely studied medical marijuana from so many aspects, but I feel like hearing this from the perspective of not only a mother, but also an industry professional is very, very impactful and definitely left a lasting impression on me. And that's why I'm honored to introduce her right now and give her the stage. Thank you.
Thank you so much, Richard. What a awesome introduction. And I remember Solevo was one of the first dispensaries that I visited. And it was really cool because really, I think they're still the only dispensary that has a committed pediatric staff and department. I just dropped my glasses, hold on. Which is incredible. So, thank you to Solevo for doing that. Thank you to you for all of your years in the industry and for always making sure our community and these topics are covered. I'm going to share my screen now. Let's see. Bear with me. Oh, no. Okay. Okay. So today we're going to talk about cannabinoid medicine and autism. And you notice that we're using the word cannabinoid medicine sort of right off the bat. And that's instead of the word marijuana. And certain, state guidelines require Solevo and other businesses within the state to use the word marijuana. But generally, we think of it as cannabinoid medicine, which historically relates to the medical aspect of the plant. Richard told you a little bit, but I am the mother of, my son's going to be 16 next week, which is crazy, but true. He started medical cannabis when he was 11. I am a single autism mom. I have another child. She's now 13. But at the time, my son Leo was 11, and he he has some language. It's mostly functional, and it's increased over time. But his challenge is he became so distressed and unhappy, and his symptoms of autism, such as OCD, anxiety, And we had, epic meltdowns. And if you're familiar with autism, we use the word meltdown, right? It's not a temper tantrum, it's a meltdown, because he would get so upset and he didn't even know why he was upset anymore. It's one of those things. And we have all kinds of professionals, educational or behavioral therapists that want to come in and tell us, to do this or to do that. But watching your child suffer and watching your child be unhappy and watching your child scream, yell, cry, and throw themselves down on the floor is just heartbreaking and debilitating to a parent. So I sort of had this defining moment where I was so desperate that I didn't know what I was going to do. And I literally started looking into schools that had residential treatment programs, because I couldn't manage him. His physical outbursts were just too much. And I had another child as well. So in that sort of moment of desperation, I had remembered that I had just seen an announcement in the news that cannabis was coming to Pennsylvania as a medicine. This was like 4 or 5 years ago, I guess. And I thought, okay, well, I had never even considered it. I had already, I think, written a book about diet and done a bunch of other things with autism, but I had never thought about cannabis, mainly because it was illegal, right? And I thought of it as something that like people smoke to get high. So I thought, okay, I'm going to look into this. And I did research for about 3 months, everything I could learn, and decided that I was going to try it. And when I say try it, literally, I didn't tell anyone. I was alone at the house with my son and my daughter. And I went to my local person, like that I trusted, who would have the cleanest kind of illicit market cannabis. And I tried it. And when I say it, and it worked. Okay. And when I say it worked, I don't mean like he's cured, he doesn't have autism. There is no cure for autism. He struggles immensely. He's still really affected, but he went from being completely unhappy and unmanageable and inconsolable to continuing to live at home with us. He's very happy. He still struggles, but he loves going to school. He has a job. He has support. He has someone with him. He has a job he goes to 3 times a week, and he's learning how to function better in society. But most of all, he's happy. So ever since then, there was nothing I could really do but educate people about it, because it was so compelling. And the difference, when you're in an emergency situation, and other times, but I think that cannabis is the best and safest option in my experience. So let's see. We talked about there's no cure for autism. So we have all kinds of pharmaceuticals that they're willing to prescribe us, very roguely oftentimes. We have nutritional supplements that we do. We have all the therapies, behavioral therapy, speech therapy, special education. And there's really only 2 FDA approved drugs for treating the symptoms associated with autism, but those come with extreme side effects, and oftentimes the highest FDA warning possible, a black box warning. So a lot of times we see families at Hope Grows and a good friend of mine has this situation where they've been on Risperdal or things like that for many years, and it's not working, or it's not working anymore. And the child has gained a tremendous amount of weight, and there's a lot of health issues that have gone along with that. And they're using cannabis to try to wean off of some of these heavy duty pharmaceuticals. So like Richard was saying in my intro, really I started, as a parent, I can't tell you the number of treatments that we've tried at our house, both on label, off label, traditional medical, biomedical, complementary, alternative medical kinds of things. But really where our stride was and where we started to see the most improvement was with natural things and with diet. And a lot of kids with autism have food allergies or GI issues, and that was Leo very much. Struggled very much with chronic constipation. We had been to many GI doctors, and finally, he had a scope, and it showed that he had lesions all through his intestines and esophagus and all of that. So one of the most important things we did was treat the GI symptoms and the gut from the inside out. Out of that was born Cooking with Leo. It's a cookbook I published, and it's basically, so Leo has a ton of food allergies, anaphylactic food allergies, really bad food allergies. And then coming from, like Jewish on one side and Italian on the other side, there was so much food influence in my house that I had to find a way to make our family recipes, but make them allergen free and healthier, frankly, to be honest. So we did that in Cooking with Leo. And through the process, I learned that Leo really was interested in food and loved to cook. And his job now is at a coffee shop, and he often does food prep type stuff. So the next logical step, if you think about natural health, and this is sort of what clicked in the time when I was researching cannabis in Pennsylvania, it clicked at some point that, the next logical step would be a natural medicine, natural diet and other things work for us. So many of the mothers, and I was not one of them, I was a fortunate beneficiary of the law that was passed in Pennsylvania. And if you don't know this, Pennsylvania was the first state to include autism as a qualifying condition with no other ramifications. Delaware had it, but it was only for adults with self-injurious behaviors. So that was quite a historic moment and step for Pennsylvania. So this is a video. This is Leo. This is when we very first started using cannabis. And we use a tincture, so it takes about 30 to 45 minutes for it to take effect. Unfortunately, the best way I find to keep the meltdowns away is to proactively give 2 or 3 doses a day. But if you see the oncomings or notice the signs of a meltdown, just keep in mind it's going to take 30 to 45 minutes typically, unless Richard knows something different that I don't know yet, for that medicine to take effect. So here's Leo before. This is one day. I have hundreds of these videos just because I didn't believe it myself, just to prove it to myself over and over. Before his medicine, and then after the 30 or 40 minutes it took to take effect. You can see that's kind of, and that's not a meltdown. That's just, I'm unhappy, I'm distressed. This is how I feel every day. And this is after his medication. Hi, Leo.
How are you?
I'm good. How are you? Do you feel better? Look at me.
Feel better.
Look at Mom. Do you feel better?
Yes.
Love you.
I love you.
So I just kept taking these videos to sort of prove to myself that it was working. Because I know oftentimes we think about, we try different treatments and it's so hard to say, well, maybe it's working and maybe it's not, but this was not one of those cases. So from there, unfortunately, dispensaries were not quite, they were just opening, and what they had available was vape pens and nothing that really seemed to make sense for a child or B, someone with symptoms of autism. So I really went on a mission and a hunt with some other moms to find different kinds of cannabis and what might be the best choice for us to try with our kids. And I went through my active social justice moment where I decided to document traveling to Colorado. And this was at the time, there wasn't any cannabis available in Pennsylvania, right? Because the way it works is that because it's illegal federally and legal state by state, we actually have to grow it in each state for that state only. And crossing state lines is illegal. So obviously I thought that was very unfair and unjust, and that, my work continues in that area. But this was during that time. So I decided to travel to Colorado to find better medicine. Oh, wait. So many of the women you see in that video, I mean, that's just like, that was even emotional for me to watch. It's hard for me to watch. They're my very closest friends until today, and that's what sort of brought us together. So from there, Hope Grows for Autism was formed. And the mission really is to just, I'm very passionate about improving the lives of the entire family, not just, obviously we want to improve the life of the person who's struggling, but in turn, we can often improve the life of the entire family. So we sort of started as an underground railroad of moms, and today we have chapters all over the world, actually. So who we are at Hope Grows, we're just parents, and basically we're determined to give our children and our families the best life possible. This is a little bit more about the resources that Hope Grows for Autism has. You can find us, we do most of our work on Facebook. We have a great support group that you can join, and there's thousands of families in there who are going through the same things. They're asking the same questions. They want to know what doctors to go to, how it works, what to use, dosing, you name it, and I know a certain amount, and I know, I know a decent amount about it, but you're going to get, when you go in the support group and you post a question, you're going to get, 10 answers versus my one. So I myself learn a lot within the group also. We also have a patient assistance program, which is something I'm really also very passionate about. Sometimes, or oftentimes, the cost of the medicine or the cost of getting a doctor's appointment and your card is a barrier and people can't access. So we give out family grants for people who need it. And, that's something we try to do as much as possible. Before the pandemic, we used to go out all over and educate, and we visited Solevo, and it's probably in here somewhere. Oh, here's Richard, probably in here somewhere, and different events and things. So now we do it like this, which is great because we can see a lot of people too. So we had an incredible webinar by Dr. Bonnie Goldstein. And if you don't know who she is, look her up. And she's at Canna Centers. They're in California. And she is a pediatrician for 12 years who has been treating children with autism with cannabis and with more natural treatments. So this is and I took some slides from her, a couple slides from her presentation with us because I thought they were really great. So here's a little bit behind the rationale of why cannabis may work well for people with autism. So it turns out that there is people with autism have different lower endocannabinoid levels or different endocannabinoid levels than other people. So this gives us, before we even try a medicine or look further, we already know that there's something different or off about the endocannabinoid system in people with autism. She has a great review of literature that includes a case study and some information about the CB1 receptors, and anandamide. So that's a little more scientific, but these are all parts of your brain and your brain connectivity that are impaired or different in people with autism in the group that they studied. And there a lot of times that those particular receptors are related to social impairment and other struggles that people with autism have. So when Richard started he had to read that disclaimer that the FDA says, medical marijuana is, I don't know if it said experimental or something like that, but we know that it's not. There is some research already. This is an overview of some of the studies that have been already completed. We also have Dr. Goldstein is doing another study out of California. There's a study in New York, I think it's Mount Sinai, where they're studying something. And there's a study that we conducted, I helped with at CHOP, Children's Hospital of Philadelphia, that should be out sometime this year. So when you go to your typical pediatrician or your developmental pediatrician and they say, well, we don't really know enough, there's not enough research, there is. And a lot of this is listed on the Hope Grows for Autism website. So we do have enough research to try that and to use this as an option. Some of the benefits of cannabis that were reported in those studies were less anxiety, less aggression. They're using temper tantrums here, but I'm assuming they mean meltdowns, less self-injurious behaviors, rigidity, stimming, better sleep. Something that was sort of, you have the immediate effects of cannabis. Like for us, there was an immediate quieting of the agitation and the outward symptoms of autism. But then over time, I started to notice that Leo was talking a lot more. Now, I don't know whether that's something that the cannabis is connecting for him in his brain, or if that's because he's calmer and his, inhibitions and anxiety are lower and he can participate more effectively. I'm not sure. So we do have research to show that there are a lot of positive benefits from cannabis. Some of the reported side effects were increased hyperactivity. We often see people saying that. Sometimes it could be the ratio. They could be using too much CBD or even too low of a dose. That's the experience I've had. Increased emotion. So oftentimes you'll see this if the dose is too high. It can make you tired. So if you're tired, you get irritable and you see increased emotion. So I've seen that once or twice with Leo when I've given him too high of a dose. And then impairment, intoxication. So, we don't want kids to be zoned out. We don't want them to be intoxicated, just like with any other medicine. We want them to be at a place of comfortable functioning. So oftentimes, again, if you give too much or the dose is too high, you can tell because you're seeing intoxication, and that means you need to probably give a little bit less. Another thing we do at Hope Grows is surveys. So we put them out through our email and we give them to dispensaries and on social media. And through this, we've been able to, in addition to the research that's already been published, we've been able to collect a lot of data. And hopefully, we're working with some local groups and hospitals to try to get those IRB approved and published. So that would be really helpful to the cause as well. But, the empirical data that we're able to collect through these surveys is for us, for parents, for physicians, it's really invaluable data that tells us what's working now in real time. One of the things that I worked on early on, in addition and separately to Hope Grows for Autism, is becoming an advisor and a partner in a range of products. So I quickly learned that I can educate about autism and cannabis till I'm blue in the face. But if the dispensaries didn't have the right products, or if I should say, really, if the growers and processors weren't making the right products, and parents were coming home with vape pens and RSOs, and in some circumstances that's needed, but most people use tinctures. So we created this launch, learn, and develop model where really in real time, we started with a survey just about flavoring, right? Because people with autism tend to have sensitivities to may have sensitivities more than others. So I did a survey within my local community, and we had unmedicated tinctures. People with autism and their families and other people taste tested. And really what was interesting is that, some of the staff at Alera had taste tested, and the results from their surveys and the autism population survey was completely different. So we went with the flavoring that the autism population preferred. There's two products in the Hope range. There's a Hope 1 and a Hope 2. They contain different ratios and different terpenes. And based on where a person may fall on the autism spectrum or where their symptoms are, that's where really your pharmacist would help you decide if one of those or another product would be right for you. Sometimes just a THC tincture helps if something's really severe, so it just all depends. But really the goal here was to create, a safe range of products for parents, to take away the guessing work, where parents could go in and say, okay, well, I don't know where to start. This is a safe place to start. And there's a lot of data behind it. The survey that we did with the Hope range of products was really very interesting. And we asked people what symptoms they were looking to improve, and what symptoms actually improved. And what I like to do is tell parents to choose, like, what are your top 3 things that you want to work on? Because to go into any treatment and say, well, I just want to treat autism as a whole is overwhelming, and it's likely not going to get you very far. So here we're seeing, we saw improvements in irritability, meltdowns, and aggression the most, and anxiety is right up there as well. And the really cool thing about this study is that, we measured quality of life. So almost 70% of patients experienced improvement in quality of life. And then, just right behind it is improvement of quality of life for the entire family. So that's something we're always looking at, and we always want to measure. And the other thing that's really interesting on this survey is that no one reported any worsening of symptoms. So it doesn't seem like it's a difficult, other than getting through the barriers of getting your card, it doesn't seem like it's a difficult treatment to try, that you probably won't see a lot of negative side effects, or any for that matter. And if it doesn't work, it's not like you have to wean off. It's very easy to come off of. But if you look at these numbers and you look at, typical pharmaceutical studies where they're studying meds for anxiety or for hyperactivity, sometimes you'll often see like improvement in the 30% range, and that's acceptable to the FDA, right? So we're looking here of real-time empirical data of, upwards of the 70% range, in some of the higher improvement symptoms. So this was a couple of years ago. This is what hope looks like for us. So after a few years of using medical cannabis, we were actually able to take our first vacation. This was before COVID. We were able to get on a plane, which is kind of crazy because it's illegal to take cannabis on a plane, but that's the only way we could get on a plane, and go to Florida and celebrate my parents' 50th anniversary. We were able to go to Disney World for the first time because of cannabis and because my son was in a more comfortable, happy place. And, these are different things that you can do. Please follow us on social media, become a member, take our surveys, get support, check out our patient assistance program. And that's pretty much my presentation for today. And I'd love to hear any questions or feedback you all have.
This is Shelley Thomas, and I have a question about the process of getting the medical marijuana card. You had mentioned that other than that, that would be the drawback to trying this. What was your experience with that?
Well, so luckily Richard has told us that they will help patients get their card. It's just, knowing how to do it. And on Hope Grows, for us, we have a video. It's how to get your card in Pennsylvania. But I think Richard is going to speak to that and maybe give you some more specific instructions. Am I right, Richard? I think you're on mute.
Sorry, trying to unmute. You are correct. Let me just kind of quickly show this screen again. Let's see. So hopefully everyone can view that screen okay. There fundamentally, there are a couple of different ways to get your card, but really what it comes down to is if someone has the qualifying condition, you have to have some type of documentation of that in some kind of like patient file and or health history at some point. You have to see a certifying physician. Again, this is specific to the state of Pennsylvania, but you have to see a certifying physician who ultimately does a patient assessment and either does certify the patient for medical marijuana or not. Just like Erica said, they have a video on her website, Hope Grows for Autism. The same is actually true for us. If you look on this screen here on our website, solevowellness.com, we have a bunch of educational resources on there in general. On our homepage, there actually is a button you can click on that it literally says, do you need a medical marijuana card? If so, click here. What you're clicking on is this other link on this screen here. It's just solevowellness.com/certifications. We have a form. We have 2 or 3 different videos on that site to just, again, general info of how to walk through the process and ultimately get your card in Pennsylvania. But we also have a form. If you fill that form out on our website, one of our representatives will reach out to you from Solevo. We cannot, as an organization, we are not by law permitted to give the patient certification directly through us. However, we do have an extensive network of colleagues, physicians in the industry, people we can definitely get you in touch with and make that whole process as easy as possible. The long and short of it, yes, you do have to see a physician. Yes, you do kind of have to get approved and or certified to receive medical marijuana. But ultimately, without getting too into the specifics, if you go to that website that's on the screen, it walks you exactly through how to do it. And someone from Solevo will be glad to help you through that as well.
I believe through the Department of Human Services or someone, there is a list of certifying physicians. I mean, that's what, that was what I was, it's not you're like your guy that you usually go to or your psychiatrist that you get your medications, regular ADHD medications to treat the focus and inattention. But there is a list of certified physicians that you could go to. That there is a list on the Pennsylvania website too. I remember that when this first came out because I was very curious how, they had to go through so many hours, like 4 hours of training or something. I don't know. Yeah. But to make sure that, this was appropriate, for your child, your specific, person that you're seeking help for. So Okay, I just, that's right. I forgot about there's a certifying. I mean, you guys will help obviously, but there is a way you can do it. If you have, you can find a certifying physician in your area, because these areas are at least, the closest one is Cranberry, and that's an hour away from where we live. So I'm sure there's other Pennsylvania people that may be on the call that are, could find somebody in their local area. So thank you.
You are completely correct. The list of certifying physicians is on the Department of Health website. It's medicalmarijuana.pa.gov. If you don't remember that, if you Google Pennsylvania cannabis or medical marijuana, it'll probably be the first link that comes up. A list is on that website that breaks certifying physicians down by county. So you definitely can find a physician in close proximity to you. Just as an FYI, and this isn't a sales pitch, if you don't go through our certification process, that is completely fine. But the vast majority of physicians at this point are doing virtual consultations. And I definitely think there's value in finding someone close to you. But if for any reason there isn't a physician close to where you live, with everything being so virtual now, typically we can connect you with people pretty easily. And again, even if it's not through Solevo, most of the physicians on the website are doing certifications virtually anyhow, if you find your own.
Yeah. And Hope Grows has a partner, a sponsor, leafwell.co, who they're completely virtual. They have, I think you can get on with a doctor within like 15 minutes. And they have their medical director is a pediatrician, and we do some educational stuff with them. So that's an option you have as well.
I have a question.
Thank you.
There's a question here. I'm going to give this to Richard. Will taking marijuana make a person an addict, and would the person take this marijuana their entire life?
Really good questions. So unfortunately, I don't have the data prepared on one of my PowerPoint slides, but if you look at the addiction profile of cannabis, it's actually very low in comparison to most other substances. And things you commonly see, I mean, talking nicotine, talking alcohol, even talking a lot of traditional medications. Again, the addiction profile of cannabis specifically is relatively low. A little bit of personal and professional opinion here. I do fall in the camp of anything potentially can be addicting. I mean, and I'm not trying to make light of this question, but certain people get addicted to working out or biting their fingernails, for example. So I am never in the camp of, something is 100% non-addictive. I just don't think that's a realistic thing to say. But again, comparing the profile of cannabis to pretty much, I can't say everything else, but most other substances and or medicines, the profile is very low. There are certain considerations. The human body can and will develop some kind of tolerance to cannabis, but that's pretty typical. I mean, that's just kind of a property of, the human body in general. You do develop some level of tolerance to certain substances. Another interesting thing about cannabis, though, you really don't develop a very high level of physical dependency to it. So just as an example, if someone is taking a lot of, I'm just going to say benzos, like if you're taking a lot of Xanax, if you stop that cold turkey, your body can and will go through some level of withdrawal when you remove that substance from therapy. With cannabis, again, that's very minimal. There's not a very large physical dependence that develops to cannabis. Some does, but again, compared to most substances, it's pretty minimal. And in terms of, is it a lifelong medication? I generally would say the jury is still kind of out about that, for kind of lack of a better explanation. One thing we do see a lot of times, especially with children, but not exclusive to children, but with a longer term use of cannabis as a medication, you do see levels, dosing levels fluctuate. again, thinking of tolerance, if you're on a substance consistently over and over again, you may have to take more at some point in order to get the same kind of benefit or same relief. But again, with chronic use, cannabis is pretty fascinating because a lot of times those dosing levels will vary. Sometimes they need increased, sometimes they actually need decreased. It very much depends on kind of the course of the disease and the course of the cannabis therapy. So I don't like to rubber stamp cannabis and say, yeah, it is 100% a lifelong medication without question. For some people, it certainly is. I don't think there's no hard cutoff. You can only be on it for a certain period of time. But the other, again, benefit compared to most medications, if and when you do have to stop cannabis, any of those concerns are pretty minimal. Again, very little withdrawal, very little like type of dependence, any of those kind of symptoms. Again, they're there, but they're very, very, very minimal compared to most other substances for sure. I hope that gives you some kind of insight. You'll see a lot of times in the cannabis industry, answers are never a simple yes or no. You know, it's always some kind of spectrum of therapy, dosing, kind of what to expect, goals, you know, all this kind of stuff can vary really pretty drastically from person to person.
Thank you. Carl, thank you so much for your note. So we just have a comment here that it's someone from another state, and they, you know, we are fortunate in Pennsylvania that we have this medicine because someone who's attending the webinar sharing about how their child started it and they had to discontinue because it's a prohibited state and it's illegal, and CPS stepped in. So that's a very real thing. I've actually recently been invited to an advisory board with Americans for Safe Access. So something I'm thinking or trying to bring to them is some sort of, I don't know if where it'll go, but some sort of blanket safe harbor act where, you know, parents are not going to be in trouble or investigated by CPS for cannabis. Even in the beginning in Pennsylvania, you know, just because we're aware of the medical marijuana laws, it doesn't mean that the police are aware. Law enforcement is aware, that Child Protective Services, that the court systems, you know, it takes a long time for everybody to learn and catch up. So that's a very, very real problem. Thank you for that comment. Someone's asking me how I got to Florida. How did I get what I needed? You're not supposed to do it. It's illegal. That's my answer on being recorded. So,
good answer.
Yeah. But look, if you see the video that I showed, you know, and you watch, go and watch the Weed Kit episode. That's what I'll say. Go on YouTube and find Herb for Autism, Weed Kit. It wasn't the Florida trip, but you'll see, you'll have your answer to that. We talked about getting a card. Okay, so someone has a question about determining dosing of tinctures. So I'll give my personal experience, and then I you know, Richard can give his professional experience. But I mean, essentially, we start low and go slow. So you could start with a couple of drops. You can start with, you know, the droppers typically have, I don't think I have one. I have one in my kitchen, but measuring amounts on them so you can see. And if, you know, my general rule in my house is that if I'm not seeing any desired effects, I increase. And if I see any signs of intoxication or tiredness or irritability, I've gone too far and the dose is too high. I also think it's really important, and somebody asked this question, we can sort of combine them. I find it extremely effective to consistently dose like any other medicine, you know, certain times of the day. So we typically take 2 or 3 doses a day before school and after school, because school is a whole issue. Before school, after school, and then bedtime. And oftentimes people will use something different during the day than they would use in the evening. But if you're just using it as a as needed or PRN, you're going to get that. You're never going to catch up with it. It's almost like if you ever had pain or you had a surgery and you come out and you're having the pain and you're already in the pain, so you can't catch up with the pain. That's how I sort of look at the meltdown cycle in our house. We don't want to keep trying to catch up with that. If we dose consistently every day, we've got it covered. So does this, someone asked, does this replace the medication that they are currently taking, or is this just in addition to, or just for those with difficult meltdowns? So no, I don't think it's just for those with difficult meltdowns. I think, I sort of touched a little bit of that. I'm gonna, it's a tool in your autism toolbox, just like anything else, right? I don't think that means that my child or another child or person doesn't need a prescription med also, or behavioral therapy, or, medical cannabis is a tool in your autism toolbox. And I think working directly with your pharmacists and finding a pharmacist like Richard that's really knowledgeable and you're comfortable with is important, I think, if you're using other medications or trying to get off other medications. And I'll let you, Richard, make any comments on that if you'd like.
Yeah, a couple things. I was actually going to start with the dosing, and you definitely hit it spot on. It's a little bit cliche, but we always do say start low with the dose and go slow with any increases. At the dispensary level, there's so many things we're going to assess for. We're doing, really a full intake, going over health history, age, diagnosis, weight, problematic symptoms, as Erica had mentioned during her presentation. But fundamentally, what we can provide at the dispensary level is a safe starting place. The number one thing that I cannot have happen, and again, it has been mentioned a few times, I am not in the business of over-medicating my patients. Does it happen sometimes? Absolutely. I'm not saying we are perfect every time, but with that being said, especially as a pharmacist, if I can get a patient started on cannabis correctly and introduce it to their body in a way that they're not having any negative effects, I've done my job. People don't always like to hear this, but if potentially for the first few days, even maybe first week or so, there is not a humongous impact on symptom relief, again, I've actually done my job because I've introduced the medicine to the patient in a way, again, where there was no negative. We can always increase the dose from there. There are some kind of weight-based equations you can use. They're far from perfect. A little bit of this is science, a little bit of it is art as well. Again, it really has to be an assessment on the dose, really depending on the patient, the individual patient, without sounding too cliche there. One of the bigger things, though, I will say is at what stage of development or even what age and size is the patient. It was not an autism patient, but my youngest patient was actually 14 months old. Very, very young, very, very small. A lot of extra considerations I have to take into account for a patient like that versus, obviously one of my older adult patients, or even getting into like geriatric patients. So dosing it's a very inexact science. We definitely have some tools and techniques to do that, but it can be a little bit tricky in some ways. The medication question. One of the things I have to overemphasize to my patients and or parents is it is never going to be a good idea to go cold turkey off of the traditional medications that a patient is on. Do we see medication reductions once cannabis is started? Absolutely, yes, we do. Are oftentimes medications eliminated because there is so much success with the cannabis therapy? Absolutely, we 100% do see that. That is something that we really need to work in conjunction with any prescribing physicians with. It can be tricky. It can be a little bit difficult, having certain conversations with certain people. Sometimes the logistics get a little bit messy, But the number one takeaway is just because you're starting cannabis, it doesn't mean you can, or for that matter, should just abruptly stop the medicines you're currently taking. That's normally something that happens over a period of time, whether that's a couple weeks or potentially a couple months to start seeing any reductions or elimination. It can vary from case to case and person to person. The biggest thing I need to stress there are potentially risks with abruptly stopping medicines. There is kind of a proper and correct way to do certain things. While I'm on this topic, cannabis is very safe, not only as an individual medicine, but it very safely can be combined with several different medicines. Medication interactions, that is something we are going to screen for at the dispensary. But again, kind of re-emphasizing the fact, just because you're starting cannabis, it doesn't mean you need to hurry up and, just stop taking any other medications. It can be a little bit of a process for sure.
I just looked something up. So someone's saying they're in Maryland, and autism is not a qualifying condition. So what we know is that autism has a lot of comorbid conditions. So I just did a quick Google search, and in Maryland, it says, it lists a few conditions or another chronic medical condition, which is severe and for which other treatments have not been effective. So I think, that would qualify. So there's certain times where it's not going to be straight up autism. You might have to go around and find something else that your child actually probably has. Okay. Could you talk a bit about CBD versus THC, and how to determine what to start with and adjustments? So everybody wants to start with CBD because it feels more comfortable, and we talk about CBD, and it feels safer. I actually did that at first. I ordered a CBD online, and I've heard, sort of similar from other parents. It really made Leo very agitated. It gave him stomach pains. So you have to be really careful when you're buying it over the counter CBD about where it's from and if it's lab tested and all that kind of stuff. But generally speaking, we find that patients with autism need at least some level, if not more, THC. My experience in the data I'm seeing coming back is that typically the more severe symptoms a person has, the more THC is needed. There was a period of time where my son only took THC. And if he was having a meltdown or something like that, I think that a PRN as needed for a really severe behavior, for us, the THC works well for that. But I know Richard deals with this all the time, so I'm going to let him give you the more clinical version of that.
Yeah, it's a constant balancing act. And I, at the sake of maybe saying something too general, maybe saying a little bit too much, when I see and or hear autism, the number one thing that I think of actually is THC treatment, for a handful of reasons. And I'm actually going to just kind of piggyback and re-emphasize what you said. CBD, it can be a little bit agitating to certain patients. If not making things worse, it certainly in some circumstances can help, or won't help, I should say. Again, that is a huge oversimplification. But again, when I was training, one of the things I took a lot of confidence in was, if someone like myself, I'm a middle-aged adult at this point without a diagnosis of autism. If I take or over-medicate on THC, it is a very intoxicating effect, or the high, for lack of a better term. But oftentimes when you give a patient with autism THC, it actually in many ways, as we saw in the video, oftentimes has the opposite effect. Maybe I shouldn't say opposite, but it does have an effect we don't necessarily expect or anticipate. It has an effect of being much more calming, much more centering for the patient. Again, I am oversimplifying this a lot, but I have also learned through my experiences in the industry for people with autism not to fear THC. And again, it is not about over medicating or overdoing it with that part of the plant, but it is and can be very effective for autism and the associated symptoms. CBD can and will play a role really in anyone's kind of cannabis journey, or I should say most people's cannabis journey. CBD just has kind of a slightly different profile. It has a ridiculously high safety profile overall. Very, very few side effects. As Erica said, probably the most common side effect is actually upset stomach. And, you know, if you take too much, it definitely can be a little bit sedating and a little bit tiring. But the problem there is it's not necessarily always perfectly effective, especially for autism. So yeah, it's safe, but we're not necessarily getting the efficacy out of it. What I do usually when I'm introducing CBD to a patient with autism, I'm doing so in conjunction with some kind of THC therapy as well. And that is when we get into the ratios. You know, should it be a 1-to-1, a 5-to-1, 2-to-1, 10-to-1, you know, whatever it may or need to be. That's kind of when we get into those numbers that were referenced a little bit early as well. Unfortunately, it's never a one-size-fits-all approach. With everything I just said, I've also seen people have success on CBD. Don't get me wrong, I'm not anti-CBD whatsoever, and it typically does play a role. But again, in my mind, I definitely connect autism and THC therapy pretty closely, actually.
Thank you. Someone here has a question. Have you seen improvements for adults with severe autism using cannabis? I actually have a cool, like a quick video clip I can show. We have a board member on Hope Grows. Her name is Andy, who is an adult with an autism diagnosis. I could share that quickly if you guys would like. If you want to unshare and I'll share.
There it is. Thanks.
Oh, good. Oh, good. Let's see. Maybe now I won't know how to do it.
Actually, while you're doing that, I'm going to address a question that was asked to me privately. It says, what was the extra requirements? Oops, I lost my chat.
Did I mess it up?
No, you're fine. Don't leave it as is. I won't read it verbatim, but it basically said, what are the extra requirements to be a medical marijuana practitioner? So although I am a pharmacist and I do not pretend to be a physician, I actually had to take the same medical marijuana training in the state of Pennsylvania that the certifying physician would have had to take. They offer online as well as live in-person trainings for that in particular. I've actually done three of the 6 approved trainings over the course of the last 3 years. That's kind of the big educational hurdle a healthcare professional needs to do, again, in the state of Pennsylvania in order to work in the industry. Other than that, there certainly are some checks and balances as well. I had to go through a very extensive, not only state background check, but also federal background check, complete with fingerprints, et cetera. And we do have to renew those periodically. There also is additional training, and again, this is just the state mandated trainings that all dispensary employees actually have to complete in order to just be in the industry in Pennsylvania, period. It is very state specific, but I think simplest answer to that question, I did the identical training the certifying physician would have done to be able to certify a patient is the same training I did to be able to work in a dispensary and consult with a patient.
And I would say that you would definitely have more experience working, you know, with the patients than the doctors even do, because you're doing it every day, right?
And thank you for bringing that up. That's a big, that's definitely a big component of the industry. And I alluded to this earlier, but there's certainly the academic training. You know, you can read books, you can attend lectures, you can watch videos, you can do this whole list of things to educate yourself on the products. But really, again, going back to this is part science, but also part art. You get an entirely different level of education as well as perspective when you're doing it day in and day out and actually working in a dispensary, talking to the patients, talking to other employees, and working directly with the medications as well, that you just cannot replicate that educational experience. That does not come from a textbook or a lecture necessarily.
No. So someone had asked about adults. So yes, severe, I mean, it would be a similar treatment, whether you're an adult or a patient experiencing those kinds of symptoms. I think people run into challenges oftentimes with adults because of their living arrangements. Sometimes they live in facilities that have federal funding or, you know, are government funded, and that can be an issue with actually giving cannabis as a medicine because of the legalities. But this is Andy Marsh. She's a board member at Hope Grows. She works in the cannabis industry at a dispensary somewhere in the Northeast Pennsylvania area. And I love this because I can't explain it the way she can. So
my name is Andy Moritz. I work in the cannabis industry as an inventory manager and educator. I got to know Erica Daniels and Hope Grows when I went to the Alera dispensary in Plymouth meeting for education on the Hope tinctures that were coming out. Up until that point, I had been stumbling around in the dark, trying to find the best products to treat autism with cannabis. And when I heard that there were tinctures coming out that would be tailored to somebody like me, I was very interested. So I went to the dispensary, and that's where I met Erica. For me, Hope has marked a significant increase in my quality of life. Before Hope Grows and the Hope tinctures, I struggled to go out my daily life. I woke up every morning and I couldn't believe that I had to go through another day living in a world that was so noisy, so bright, and so painful for someone like me being on the spectrum. And with Hope Grows, I found a community and an industry that I don't have to mask in anymore. I can be myself. I can be authentic with all of my quirks and differences. And instead of being shamed for them, they're appreciated. My name is Andy Moritz, and I have hope.
I think there was another one that showed her.
Hope
she
Grows
talked
came
more
to be 4 years ago.
Oh, gosh,
I was
stop.
sitting in.
I have to look for it. I feel like there's another one where she talks more about how cannabis helps her. But yes, adults are definitely a big part of the treatment population. I lost my questions here.
So while you're pulling that up, let me just kind of address one of these as well. There's a question that says, who advises, the pharmacist or the certifying physician? Ideally both, to be completely honest. So when a patient or caregiver parent, but when someone goes for a patient certification, actually seeing the certifying physician, they definitely have certain, I guess I would say, protocols and things that they go through. There's an informed consent process. There should be some level of education that happens there. Again, talking about the cannabinoids, talking about THC, CBD, potential side effects, potentially products to look for, and maybe some dosing suggestions. Those are all things that a certifying physician should offer. Whether they do or do not is it's a little bit questionable, depending on the physician. Again, it's things they should do, but aren't necessarily required to do so. And again, I love the certifying physicians I work with, but some of them just aren't equipped to really go in depth with any sort of consultation on the products. The products change regularly. Sometimes the names will change, but it'll be the same product, or vice versa. Sometimes concentration changes. So like, 1 week you might get, and I'm kind of making this up, but 1 week we might have a regular strength tincture. The next week it's the same product, but it's the extra strength version. So it's things like that at the dispensary level we have to catch and be sure we're like very diligently counseling people on like the right amount to take, doing any sort of dosing conversions or anything like that. I'm a little bit biased on this topic in particular, but I guess another way I would explain it, I treat every patient that is new to Solevo as if they are new to cannabis and that they really don't have much or any knowledge on the plant, its benefits and or the products we offer. And I don't say that disrespectfully, that's just my approach to patient counseling. Now, can we or will we tease something out through the course of a consultation? Absolutely. If I'm treating a patient or parent or caregiver as if they're brand new and have no education base here, I'm going to kind of assess what the patient does or does not know and assess what the physician may or may not have told the patient. I'm certainly not here to undermine any physician recommendations or anything like that whatsoever. However, part of that initial intake and consultation is really assessing, kind of a knowledge base and do any sort of consultation, as kind of granular or as specific as I potentially need to. Really, it should be kind of a dual, you should get some info from the physician, some info from the dispensary. But in reality, we do see people come to us completely unequipped with any information whatsoever. That's fine. Like we're going to do our job then, and kind of walk people through the whole process.
Awesome. We have a 12-year-old who only eats 3 things. What are the 3 things? I'm thinking chicken nuggets, if applesauce is one or something. So, okay, who only eats 3 things and drinks only water and won't swallow pills. How could we get the medical marijuana into the child? That's definitely something that parents talk about in our support groups. I've seen parents I know put it in applesauce. Ideally, the tincture should be dropped under the tongue and left there for a period of time, 30 seconds, a minute, or even longer. We know that that's not happening all the time with our kids, right? My son is really good about letting me drop it in his mouth, but you could maybe, use something like applesauce or that consistency. Do you have any other tricks, Richard?
The best thing I ever heard, and again, very case by case specific, if the patient is drinking something or anything,
Water only this patient will drink.
Yes. So, and Erica is completely right. Tinctures are designed to be dosed under the tongue. That is in the ideal situation. If though a tincture is swallowed, that is completely fine. The medicine is still getting into their body. It still should have some level of effect, if not be equally as effective. The biggest distinction to make there, though, is when you dose marijuana under your tongue. Erica had said earlier, about 30 minutes or so until it takes effect. That's pretty typical. I would agree with that. For some people, it's a little bit quicker than that. Some people potentially a little bit longer. But I will say 30 minutes is a pretty realistic expectation there. Now, if you swallow cannabis, you're talking about a little bit of a different profile there. When it's swallowed, it will take longer to kick in. So that's one thing to at least take into consideration with anything I'm going to say here, or with mixing it with applesauce, for example. And again, a tincture can be mixed. It's not always perfect. The pharmacist in me, starts to think, are things getting diluted or degraded or digested in a way we don't want to? Potentially, but again, we have to do what we have to do. So there's circumstances that warrant this. Tinctures can be mixed in a drink. It's not necessarily ideal. They are oil tinctures, so they don't, absorb or they don't dissolve into a drink perfectly, those kind of things. So those are considerations too. But I have counseled people on more difficult cases. If you can get the patient to drink through a straw, a little kind of trick technique is to actually drop the tincture dose into the straw. So when they take that first sip, they're literally getting the first amount of the medicine. It's certainly less diluted, and they're still in that process of drinking. So hopefully it's not only washing the tincture down, but also helping to mask any taste considerations or anything like that as well. That's one thing I've found particularly effective in some of my cases, but again, it's not necessarily a one size fits all.
Could THC help eliminate the need for Ritalin? Improve focus, attention, and agitation. Currently on 20 milligrams of Vocalin. I mean, I know that ADHD is very common, comorbid with autism. And I know that I've seen for my son, it helped improve. I've also noticed, sometimes people will go with something more like a 1-to-1 blend or less THC if they're looking more to just focus on the Ritalin or the focus and clarity part. But I mean, that's been my experience with it. Richard, do you have any more experience there? I'm sure you do.
I completely agree. I would say, I mean, this is a little bit personal, a little bit professional. I don't think cannabis is an exact replacement for like an Adderall or Vocalin or something like that. However, we do see patients with ADHD have success on cannabis, although it's technically not a qualifying condition.
Right.
We do see some success there. In simplest terms, let me say, the videos, again, thank you so much. The personal videos you share of your son, I think those actually kind of speak to this question, not necessarily perfect, but very much having that more calming, focusing, recentering effect for these specific type of, symptoms or issues that we do see.
Mm-hmm. Thank you. What is a good resource for learning more of the pharmacology? Well, I know one book that I love, and then I'll hand it over to you. But this is like in my Bible and because she specializes and works with a lot of autism patients, this is Dr. Goldstein's book. I would recommend that, but Richard, you're the pharmacist.
No, first of all, let me say I second that. I've met Bonnie Goldstein and she's great, so I definitely second what you said there. If anyone is interested in investing a little bit of money, not much, just like you would for the Bonnie Goldstein's book, there is a book called Cannabis Pharmacy that is particularly, I personally love it. It's an excellent resource, almost as like an encyclopedia, almost very quick reference. You very easily can look up conditions and get recommendations from that, or you can actually look up specific strains and or products. And it'll kind of walk you through those and give you some suggestions there. That book in and of itself, it's not overly expensive. I want to say it's about $15 on Amazon. Don't quote me on that, but either way, it is affordable, but it's a little bit of an investment.
Yeah.
I've gotten in trouble for saying this previously, and this is being recorded. So here we go. If anyone's looking for more of a free resource, if you go to leafly.com, I like Leafly and I do use it as a reference. A word of caution I always give people, it is kind of more of an industry website. It's not necessarily the most professional presentation at all times, but it is incredibly comprehensive in terms of the information they have on there. It's all free. It's an excellent resource for strains, products, suggestions. They have videos. I mean, when I say comprehensive, that has to be the leading website in the industry, just from an information standpoint, and again, free to access. If you wanted to take it a step further, on the Department of Health website, the training providers for the healthcare professionals are listed. You actually could take one of those courses, and again, most of them are available online. You don't have to go somewhere and do it in person. They do start to get a little bit pricey. You're typically talking somewhere in the $200 to $400 range for one of those courses, but that's a really nice introduction to more of the clinical again, more clinical and medical and academic side of the industry for sure. Just something to keep in mind there potentially.
I also like healer.com, which is Dr. Dustin Sulak's website. And he does have a lot of free resources, but you can also, again, I think, pay or subscribe to his more detailed courses. And I think you can get certifications and things. I'm not sure, but that's a really good resource also. He's great. Let's see. Would adults need very high doses of the hope tinctures for autism symptoms? Would these adults be more inclined to use inhaled form due to cost? What do you say to these patients? I don't know. I think whether you want to inhale or use tinctures is a personal preference. And, you know, oftentimes dose doesn't correspond with weight necessarily. So again, I think you're sort of back to what works best for you and trying to slowly increase doses over time. I don't know that you need to start out with a much higher dose because you're an adult. Am I correct, Richard?
Generally, yes. Now there are going to be some considerations there. Obviously, someone that's single digits, or my 14-month-old is not getting the same as one of my 25 or 30-year-olds, or one of my 80-year-olds for that matter. But you're right. Like I had mentioned a weight-based calculation earlier. They exist, but I promise you they are far from perfect. Typically, I only go to them for the smallest of the smallest patients. There's some things we can account for, but again, dosing isn't an exact science. And just because someone is bigger, smaller, just because someone's male or female, there's not necessarily like any perfectly directing dosing, parameters or anything set up at this point. The inhaled thing, that's one of the things that I think it's incredibly important that is assessed probably the first thing in a consultation. The biggest thing when you inhale cannabis, I had talked under the tongue a little bit, and when you swallow it, when you inhale cannabis, the effects are almost immediate. I don't like to say immediate, but I will say within a couple minutes, you feel the effects and hopefully get some relief from that. It's actually a very effective way to use cannabis, especially with autistic patients. It's not always the perfect match. There's an age consideration to at least take into account there. And fundamentally, it does come down to patient preference. If someone doesn't want to inhale, that's completely fine. I'll talk about every other option I have. But that's something I need to assess very early on in the conversation, just so I'm not talking about products that, don't even really apply.
Yeah, I think we have time for about one more question. How important do you feel terpene profiles are? Which ones for autism? Do you consider the entourage effect when making cannabis recommendations? I'm going to hand that over to you, Richard.
I definitely consider entourage effect without question. Terpene profiles are very important. We do take them into consideration. And again, there's more considerations if it's a capsule, if it's inhaled, if it's a tincture. Terpenes have different impacts depending on how cannabis is administered or consumed, however you want to word it. I personally think I'm fascinated by terpenes. I'm fascinated by the entourage effect. Again, it very much comes down to not only symptoms, but also time of day, really what you're trying to achieve, goals of therapy, all those different kinds of things. Again, we talked about concentration or kind of the Adderall ADHD thing a little bit earlier. The number one thing that speaks to me there is pining. It's actually good for cognition and potentially good for focus. If there needs to be a more calming effect, the number one thing I think of is linalool. Potentially myrcene, but myrcene can be much more sedating as opposed to calming. If it's more depression and or getting into a little bit of anxiety, I would think limonene. I could go through a whole list, but the simplest answer is absolutely yes, that is considered and taken into account depending on how the patient presents.
Thank you.
Okay, so I think we're at just about 2:30. Sorry. This presentation is being recorded and will be up on the Hope Grows for Autism as well as the Autism Connection YouTube pages. We at Autism Connection will also put it on our website under our blog. And if you have any other questions, you can for sure reach out through everybody's websites. Again, Richard works at Solevo Wellness. Erica Daniels is from Hope Grows for Autism. And I am Jennifer from Autism Connection of PA. You can always reach out to us at our help email. It's help@autismofpa.org, and I can redirect any questions you have. I can forward those emails if you have anything that comes up later on. So I'd like to thank Richard and Erica for doing this workshop today, and thank you to everybody who attended.
Thanks for having us.
Thank you, guys. Thanks.
Thanks.